Hello everybody, Andrea Twarowski here with Dentalelle Tutoring. We are going to be talking about perio today. Now I have done a lot of videos, or so it seems, of perio, but I feel like you can never talk about it too much because everybody always has questions. Whether you're a dental assisting student who's kind of like, okay, I know I'm not a hygienist, but I need to kind of know the perio, what the stages are, what the heck's happening. And if you're a dental hygiene student, this is what you do, right? It's all perio. But what I don't often talk about are the basics. So I may be telling you the different stages and things that you have to know for the board exam, but I don't really tell you the basics and what happens when your patient has a 4mm pocket. What do you do? Is that perio? Is it not perio? Is it kind of perio? So I don't talk about the basics. So that's what I'm going to talk to you guys about today, and kind of how to explain it to your patients too, because if you're new at this, you telling your patient that they have perio, they'll be like, yeah, whatever, but you have to explain it in such a way that they understand, and they especially understand the importance of it and why it's so important that they will have to come in more often for their cleanings. So let me first talk about that. So if your patient, let's say you're doing a probing on your patient and they have quite a few 4mm pockets, that means they need to be coming in more often for their cleanings. If they have one 4mm pocket, that's okay. Things happen. You could have been pushing too hard on the probe. They could have missed that area for the past week. But if they have several, they need to be coming in more often for cleanings. Now, if they're already coming in, let's say every 3 months, and their 4mm pockets aren't getting any better, find out why. Find out, is it because they don't brush twice a day? Is it because they don't floss? Is it because they didn't know they had to brush twice a day? Is it because they just simply don't care? So find out why. If they're saying to you, well, they don't brush twice a day, well, there's your problem right there. Tell them that those 4mm pockets can go away, but they need to brush twice a day. If they're not, it doesn't even matter that they're coming in every 3 months, because it's not, reaching its full potential, if that makes sense. They need to be following up at home as well. I have those patients who say to me, well, I don't floss because I see you every 3 months. Well, yeah, okay, well, it's nice to come in every 3 months, because if they didn't, things would be a lot worse. But you also need to tell them, well, if you don't floss, those 4mm pockets won't go away, and that harbors a lot of bacteria. Everybody, plaque and tartar harbors a lot of bacteria. If their gums are bleeding, say something to them like, well, if you had a cut on your hand, wouldn't you be concerned? If your hand bled all the time, wouldn't you be concerned? They may say to you, well, my gums are bleeding because you're in there. Well, say to them, well, I have to get in there to take away the plaque and tartar that's in those 4mm pockets, because your toothbrush can't reach that. Their toothbrush can only reach to about 2.7 millimeters. So let's say 3 millimeters, that's it. So that's why we consider 1, 2, and 3mm pockets to be healthy, because their toothbrush can only reach up to 3 millimeters. As soon as they get that 4mm pocket, things are not healthy and they can't clean there properly, which is why they need to be seeing you guys every 3 months to come in for a cleaning so that you can clean things in there properly. Now, if they have 4mm pockets, 5mm pockets, 6mm pockets, oh my God, it's even more important for them to come in every 3 months. It's so important. Even if it's not covered by insurance, you need to tell them this is so important, because this is their health. If they just simply brushed and flossed every day, they wouldn't have those 4mm pockets or 5mm pockets or 6mm pockets. But a lot of people don't see it like that. Even I have said to a lot of people, let's say they're sore after their cleaning. I will say to them, well, you would not be sore if you brushed and flossed every single day. It's actually easier for you if you do that, because if you do that, there's not as much plaque or tartar when you come in to see me. If there's not as much, I don't have to push as hard to take it off, and I don't have to scrape as much to take it off. So if there's less there, it's a win-win for both of us. It's a win-win for them, and it's a win-win for me, because I don't have to clean as much, they're more comfortable. It's easier for me, it's easier for them, it's probably cheaper for them too because they're in for less amount of time. So I mentioned that to them as well. Now keep in mind that if they have pockets usually higher than a 5 millimeter, if it's everywhere, they should be seeing a gum specialist because they have longer instruments. They can open up the gum to reach those harder to reach areas. Like I can tell you, if a patient has a pocket of 8 millimeters, I don't know what I'm doing. I can't see in there. I'm cleaning the best I can. I'm using the piezo or the Cavitron, but I can't see a thing. So I don't know if I'm actually cleaning properly. So at the gum specialist, they can pull the gum back, open it up, and clean right in there. Plus, that is what they do all day, every day. So they know how to clean teeth, right? I'm not saying that we don't. No, we know how to clean teeth, but do we know really how to clean 8 millimeter pockets? I can tell you right now, I don't. I've been in the dental profession for 13 years and I don't feel comfortable cleaning 8 millimeter pockets because you just can't reach them, right? So something else to mention to your patients, because your patients may say to you, well, why would I go see a gum specialist when I get my cleanings done here? Do you guys not know what you're doing? You know, some rude patients may say that. So then I would say to them, well, we don't want you to see the gum specialist either, but your gums are in such bad shape. You have periodontal disease, a very severe form. There's mild, there's moderate, and there's severe. You have the severe form where if it's not being taken care of, you will lose the teeth. Plain and simple. It's not my fault. It's their fault. You know, I say it in a nice way, of course. I'm just being haha because of the video. But I do say to them, like, it's not my fault that you have those 8 millimeter pockets. Brush, floss, do what you have to do. But even if you start to do that now, yes, that's a good thing. But you can't clean right in there because your brush and floss can't reach those 8 millimeter pockets, which is why you need to be seeing a gum specialist. See? So just keep explaining it to them. Keep explaining it to them, even if you feel like that's all you're doing every time they come in, but it's so important. Now, some patients may insist that they brush and floss every day. They brush twice a day, they floss every day, but their gums are still horrible. The gums are bleeding, they have 4 millimeter pockets, they have 5 millimeter pockets, so then what? They might be lying to you, or they might not be brushing or flossing properly. So this is when you have to ask them to show you. If for some reason you don't feel comfortable doing that, then show them. You should say something to them like, well, let me show you how to brush and floss a different way, even if it's the same way, so that you can learn something new. Because for you, for these gum pockets, this is kind of the brushing that you need to do. I'm just going to have a little bit of water there, you guys, for just 1 second. There we go. Okay. So that's what they have to do. So even if you've shown them a million times, or they're 55 years old and you kind of think, I don't know if they're going to let me show them how to brush because they're just going to say to me that they know how. Just keep on doing it, okay? Show them. And usually I find if you recommend an electric toothbrush, that's at least a good first step, because who doesn't need an electric toothbrush? Some studies out there might say that if a patient has a recession, the electric toothbrush could I'm sorry, you guys. I am starting to lose my voice. Let's see. Okay, you guys, I'm sorry. I just took a larger sip of water because my throat is a little bit scratchy. But if those patients have gum recession, just be careful that they're not brushing too hard. But in my opinion, it's still a good idea to use an electric toothbrush because that may actually help them to not brush too hard. But some people say that using an electric toothbrush actually means that they will brush harder. Depends on who you talk to, but I just don't feel like that. And I feel that electric toothbrush actually helps them clean properly, so it certainly can't hurt. And a Waterpik. If you guys have that patient who won't floss no matter what, recommend a Waterpik. They are actually excellent. Like, I have seen those patients who will not floss, like they just hate it and they won't do it, buy a Waterpik and they love it. They use it every day and it actually helps. Yes, it's better to floss, but if they're not going to, you have to try something else. Recommend a Waterpik. But for the Waterpik, there's usually a low, medium, or high setting. The high one is brutal. Like, think of the power washer you use on your house. It's a high setting. So please tell your patients, use the low to moderate setting at the most. Don't even dare touch the high setting because that can actually hurt. And tell them it's a Waterpik, it's messy. Think of it as a power washer, but it's awesome and it does help to clean. Some patients have even told me that it feels good to use it. So tell your patients that other patients have said that it feels good to use it. Hopefully they will buy it. They're not that expensive. Depending on where you go, they can be about $50 to $60. If they're on sale, they can be $40, but they're awesome and they last forever. So why not? But yeah, for perio, it's a good idea to just keep explaining to your patients that that's why they need to come in every 3 months, because the inside of the mouth starts everything. If the mouth isn't healthy, your whole system isn't as healthy as it could be. Plain and simple, because plaque and tartar harbors a lot of bacteria. If you noticed a cut on your arm, hand, you would be concerned. So having a disease inside the mouth is like having cuts all inside the mouth that need to heal. But you can't heal them properly on your own. So that's why they need to come in every 3 months for us to help them, and proper oral hygiene at home. Very important. If the patient's a smoker, that will not help the situation. They need to brush and floss even more than anybody else. They need to use mouthwash, the whole works, because that smoking just doesn't help because it's not healthy. And that smoke goes in the mouth first. So that high temperature, that unhealthy chemicalness is inside the mouth, and that's not helping the mouth either. What else do I tell my patients? Those are pretty much the main things. And if patients have questions, ask them if they have questions. I find it especially important that if you're doing the probing, let them know that those 4 millimeters, the 5 millimeters, the 6 millimeter pockets that they have can become healthy again. They can become less and less. How? By brushing, flossing, and seeing you every 3 months. Because a lot of patients don't realize that they can be healthy once again. They often think, well, yeah, I'm not healthy now, so you are stopping it from being even more unhealthy. But no, we are actually helping to make things healthy. Now, if your patient has an 8 millimeter pocket, you often won't be able to see a 2 millimeter pocket again, but you should be able to see a 4 or even a 3, depending on the patient, depending on the pocket, depending on a lot of things. But just tell your patients, those high pockets can become healthy again. They can be. It takes time, but they can become healthy again, and then they don't have to worry. Another thing that I tell the patients also is, yes, we may be seeing you for 3 months now, but if things get healthy in there, we don't have to see you every 3 months after that. It could be every 6 months, it could be every 9 months, but we need to get things healthy in there. There are people out there that they just need to come in every 3 months to keep things healthy, because a lot of patients might think they're the only ones, or they may think like, oh geez, are things really that bad? Like, I've never heard this before. You know, they may be saying that. So let them know that they're not the only patient who has to come in every 3 months. Let them know that if they start coming every 3 months, have excellent oral hygiene, that soon every 6 months is okay, every 9 months, but they need to start somewhere. So I hope that helped. Talk about perio and explain it to patients. This is a great video for the real world, because patients will have questions. And especially if you're new at this whole thing, you may be thinking, how do I answer a patient if they're asking about perio? Like, what do I even say, you know? So it takes time, but keep on talking to them about it and just let them know that things can become healthy again. Just brush and floss. It's that simple. Okay, you guys. So thank you for listening, and I will see you guys in the next video.